Hello friends, Namaskar. This is the last lecture of our week number 6, Auricular Acupuncture, or you can call it ear piercing. Very interesting lecture, and I have added an Indian component also because ear piercing is very common in India. What you see on the image, these are the basically 6 acupoints on the ear which provide lots of health benefits. That will come. It will come in part 2 of the lecture. You have probably heard of traditional acupuncture, which uses small needles to stimulate points throughout your body, including your ears. But there is another type of acupuncture that focuses exclusively on your ears only, nowhere else, no other part of your body. It is just around your ear, in the ear, that acupuncture can be done. That is called auricular. It is called auricular acupuncture. This is a type of auriculotherapy which describes any acupressure or acupuncture treatment that is just limited to ears only and nothing else. For ease of explanation and understanding, divided into 3 parts. Part 1, ear piercing, Indian tradition. Why do we have ear piercing? That tradition all over India, north, south, east, west, city, villages, anywhere. Part 2, auricular acupuncture, and part 3, types of ear piercing. Who is this? Lord Krishna, child Krishna, and you can just see ear piercing, the left ear of Lord Krishna. So this particular tradition, it is into India since last hundreds of centuries, thousands of years back. It's an ancient Indian practice which is also known as Karna Veda. Karna means ear, Vedna means piercing. Karna Ved, Karna means ear, Ved means piercing. It is one of the 16 sacraments, rituals and sacrifices done to mark the various stages of human life and to signify cultural heritage and upbringing. Generally, we see girls, ladies, they get their ear piercing done and they think it gives a good look, but they do not understand, they never think that ear piercing has lots of health benefits too. Let's see them. First point is reproductive health. According to Ayurveda, the lobe of the ear, this is the lobe of the ear. Lobe of the ear has an important point right in the center, just here, right in the center. This point is one of the most important areas for reproductive health. Moreover, piercing of ear also helps maintain a healthy menstrual cycle in females. Brain health. Ear piercing at an early age in kids is said to ensure proper brain development. The ear lobes have the meridian point that connects the right hemisphere to the left hemisphere of the brain. We generally say the brain has got 2 hemispheres, right and left. So if you get your ear lobe pierced, both these lobes of brain get connected. Piercing of this point helps activate these parts of the brain. Principles of acupressure therapy also claim that when these meridian points are stimulated, it helps in healthy and quick development of the brain. Energy. It is said that when people wear earrings, the flow of energy is maintained in their bodies. Eyesight. The center point of the ear, where the center for vision lies, central point of the ear. This is the central point of the ear. Thus, applying pressure to these points helps improve the eyesight, improves ear health. As per Ayurveda, the point where the ear is pierced is where two essential acupressure points are present: master sensorial and master cerebral points. These 2 points are the key players in maintaining the hearing of your child. Acupressure experts say it is a good spot to help relieve symptoms of tinnitus. Tinnitus, sometimes we get ringing or buzzing in the some sort of sound. It's not external sound. Some buzzing takes place in your ears. That ringing, and that is called tinnitus. Prevents conditions like OCD, nervousness and anxiety, all psychological diseases. Along with the healthy development of the brain, ear piercing keeps condition like hysteria at bay. This area is also the seat of the master cerebral, which governs the working of the brain, claims the acupressure theory. It is said that applying pressures at these points helps keep mental illnesses like OCD, anxiety and nervousness at bay. Improves digestion. Stimulation of this point is said to maintain one's digestive system. This is also the hunger point, and its stimulation reduces the chances of obesity. Hunger point. Therefore, lal mirchi, that is red chili, that shows the hunger. Generally, we like chutneys, some sauce made of red chili. Sperm production. In man, ear piercing is believed to help in sperm production, and that is why ear piercing for boy is a compulsory tradition in various communities to help maintain their reproductive health. The right age and time to get ear piercing done according to Ayurveda: each 10th, 12th or 16th day, or in the 6th or 7th or 8th month, when a boy is just a child, or you can get it done in any odd years from the year of childbirth. In short, ear piercing should be done when a child is too young. Ear piercing is specific to each gender. When a girl's ears are pierced, the left ear is pierced first. On the other hand, when a boy's ear is pierced, the right ear is pierced first. This is because the specific points coincide with the masculine and feminine halves of a person. It is believed that the right side of the body is the masculine side, while the left half is the feminine side. That is all about Indian tradition of ear piercing. I thought I must tell you, because the audience of this particular course, that is Certificate in Integrative Palliative Care, I hope it will run in thousands, because this is our 3rd course. In earlier courses, the Foundation Certificate in Palliative Care and Certificate course in Palliative Care, that was the 2nd course. We had almost about 3,000, between 3,000 to 4,000 people watching those things. So, in this also, the girls and boys will understand what ear piercing is all about. Auricular, let's see the Western version. Acupuncture is based on the theory that your health depends on the flow of chi in your body. This energy travels along invisible pathways known as meridians that are found throughout the body. According to TCM, a blocked or disrupted flow of chi can have a negative effect on your physical and mental health. Acupuncture aims to restore the flow of chi by resolving any blockages or disruption. Traditional acupuncture does this by targeting points found throughout your body, including your ears. This is the ear piercing, central part of the ear. What are the potential benefits? Auricular acupuncture can tackle the following: chronic pain, especially low back pain, migraine, anxiety, insomnia, cancer pain and chemotherapy side effects, weight loss, substance use disorder, depression, digestive issues and different allergies. There is very limited evidence that auricular acupuncture can treat health condition on its own. However, there is promising research suggesting it can be beneficial for a range of health conditions. We will just take on first, that is a pain relief. There is a survey which was conducted in 2017 and the results suggest that when used properly within 48 hours of pain onset, then it gives better benefits. Substance use disorder recovery. There is also some evidence to support the use of auricular acupuncture for help with substance use disorder. There is a 2017 study which generally substantiates this particular claim. There are more than 200 acupuncture points in the ear. Just in the ear only, more than 200 acupuncture points. In 1990, the World Health Organization created a standardized list. Of these 39 standard points, 10 master points are often used in auricular puncture treatments. Some of the most commonly used points in the ear include Shanman, also called ear Shanman, to differentiate it from another point on your waist. Point 0, kidney. What should I expect from a session of auricular acupuncture? This session may vary slightly from provider to provider. Who is your acupuncturist will differ. Some may use a combination of acupuncture points, while others might focus primarily on the master points. But in general, a practitioner will start by going over the symptoms you want to address. They will likely ask you a few questions about yourself, your sleeping habits, past or current medical issues you have, your mental health concerns, and diet and digestive system. What should I expect from a session? If you are having acupuncture done on your ear, you will likely spend the session in a seated position. Auricular acupuncture is generally done, you do not require to sleep or lie down anywhere. You remain seated on a chair. It will be done on a seated position. We saw an image earlier that the boy was just sitting over there and his ear was being punctured. But if you are having other points stimulated, you may be asked to lie down on your stomach, back or side. Next, the practitioner will bring inserting needles. This may sting briefly, though some people do not report feeling anything during the session. These needles are little different from the needle what I saw you in the acupuncture lecture. These needles are not so fine and sharp. With the needles inserted, you will sit or lie quietly for between 10 and 20 minutes. Finally, the needles will be removed, which is usually painless. Is it safe to try? When performed by a trained and experienced acupuncturist, acupuncture is fairly safe, according to the National Center for Complementary and Integrative Health. If acupuncture is not performed correctly or needles are not sterile, you may be at risk for serious side effects. Therefore, you must go to licensed acupuncturist only. Some people do experience mild side effects after an acupuncture session, such as nausea, dizziness, pain or tenderness around the involved areas. It is also best to avoid acupuncture if this is a caution given to you should avoid if you are pregnant, at some points can induce labor. Because of the pain, something can happen. If you are having a pacemaker on your heart, which could be affected by the mild electric pulse that is sometimes used with the acupuncture needles. If you take blood thinners or have a bleeding disorder, then also you should avoid this auricular acupuncture. The bottom line, acupuncture in the ear is an alternative treatment that may help with common health issues from chronic pain to digestion issues. If you are interested in trying alternative treatments or haven't had much luck with other approaches, auricular acupuncture might be worth a try. However, be sure to see a licensed acupuncturist only. Now we come to the part 3 of our lectures, that is the types of ear piercing. I will tell you about 5 types of ear piercing and its possible health benefits. Alexandra Rush reports on some of the health benefits that you might possibly gain just by piercing your ears. This phenomenon is looked into by 2 specific fields, acupuncture and auriculotherapy. This diagram tells you it is here that your ear is located. Now, if you see this diagram, then lots of nervous systems and other things, they are coming out from your ears and they are going to various different parts of your head. Earlier I said that ear puncture, ear piercing might affect your vision. It improves your vision because there are certain nerves which are going towards ears. Before diving into the 6 different types of ear piercing and their health benefits, it is important to get some scientific background. The correlation between parts of the ear and other parts of the body was first identified by Dr. Paul Nogier, a French neurologist and physician. That's a modern medicine. Otherwise, in India, it has been noticed, it has been acknowledged thousands of years back that ear piercing is very, very beneficial for health effects. Dr. Paul Nogier, his research shows that by piercing certain parts of the ear, it stimulates the surrounding nerve areas. In certain cases, this sends a flow of energy through the body, which helps alleviate types of pain and regulates the body's functions and internal organs, according to lifemaghealth.com. There are 2 different cultural approaches to auriculotherapy. The Asian approach, that is our approach, is based on the understanding of health and disease of traditional Chinese medicine, using concepts such as qi, yin, yang and 5 elements. In contrast, what is Western approach? It is biomedical, using concepts of neurophysiology. This science is now researched worldwide and the results are being published in other journals. Auriculotherapy is now considered by many people acceptable all over the world. Can you gain health benefits simply by piercing certain parts of your health? This is what it is. Yes, you can get some health benefits. These are the ear points. If you pierce here, this is the allergy point. If you have got some allergy, lots of people have got allergy to particular things, some weather, or even if they eat something, they have their allergy. Shenmen point, autonoric point, point 0. This is for the stomach, digestive system. Oscillation, endocrine, master cerebral, master sensorial, and thalamus. We'll see in detail in next few slides. The daith, the first point, daith, D-A-I-T. It is located in the smallest fold of cartilage. Which is the smallest fold? It's shown here. This one. There are various folds. This is one fold. This is another fold of the ear, and this is the external ring. This particular thing, which we can say generally divides the ear into two, this is the smallest. This is the daith piercing. If you do this like this, earring has gone like this. If you have the daith piercing, then it is a popular theory that the location of this piercing may help to relieve migraines. Very important. And there are certain other things they have written, but this is the most important point. The piercing on the part of daith, it relieves migraines. Second, the conch. The conch piercing are a type of cartilage piercing that is named after the spiral shape, a conch that ears take after. Supposedly, this piercing targets the acupuncture points that aid in muscle relaxation. This is the conch. Conch, that is what we generally blow in temple. So, this part is called conch, and that is where piercing takes place. This is associated with combat chronic pain. So, the conch piercing helps you in combat chronic pain. Third, the forward helix. The forward helix piercing is located on a small piece of skin at the very front of the ear that attaches the ear and the head together. Ear and head. This is the head part, ear part. So, it is here. This is called forward helix. The forward helix may stimulate a specific acupressure point to help relieve tense muscles, these muscles, encourage blood circulation, and prompt your body to release energy for healing. Earlier we saw forward helix, now comes the helix. It is the cartilage piercing. Where is it located? This part. This is the main cartilage of your ear, and the piercing takes place here on the upper part. This particular thing, it relieves symptoms of allergies as well as it can aid with insomnia. Fifth, the lobe. This is the common ear piercing, is often given to children as their first piercing. This is normal, this is common all over India, like it is here, this part. It will improve their eyesight and allow for better sailing. So, but most of us, the people who have got the lobes pierced, they do not know that these are the health benefits accruing from such acupuncture. Disclaimer, dear friends, more case studies are making their statements on if piercing can really aid in health benefits. It is important to note that this is a new alternative medicine practice that is not fully accepted yet. I am talking about Western countries. This has been already fully accepted. I can roughly say that 50 to 60% of Indian populations have got their ear piercing done when they were children. This is also a disclaimer. I can't claim it, but I personally think it that way, and we do it traditionally. We don't worry about health benefits or not. Scientists don't know enough about this treatment to rule out the placebo effect. But we do know that getting acupuncture to treat migraine is fairly effective. In conclusion, your friend's piercing may initially have the effects previously mentioned, but once healed, there is the possibility that the effect of the piercing may decrease over time. Piercing can also be dangerous, especially in cartilage areas, so it is important to clean the piercing every day in order to prevent bacterial infection and piercing bumps. In conclusion, if you are up to trying new alternative medicine practice and are not opposed to having some fun bling in your ear, this 5 piercing may just be the right for you. Thank you friends.